LVOne is a rapid blood test for identification of ischemic stroke caused by large vessel occlusion. LVO stroke is responsible for most stroke disabilities and deaths. LVOne is intended to be used by trained professionals to aid the diagnosis of LVO stroke in patients with suspected stroke. The test is an in vitro diagnostic device that uses finger prick blood to measure two blood proteins called D-Dimer and GFAP. The LVOne kit comes in a bag and needs to be opened with a pair of scissors, which are not provided. In each bag you will find a lateral flow cassette for D-Dimer, a lateral flow cassette for GFAP, 2 lancets for finger pricking, 2 capillary pipettes for blood collection, 2 buffer ampules with chase buffer, 1 scorecard for results interpretation, and 1 rapid IFU containing test steps and results interpretation guide. The full instructions for use are available in each box and must be read before the test can be performed. We start the test procedure by opening each lateral flow device. It is important to explain how the pipette works before we begin the practical demonstration. The pipette works by capillary, using the small tube that you can see here. The pipette collects blood automatically, and it is very important that you do not press the pipette bulb to collect blood. The bulb is only for dispensing the blood, not for collection. Here is a practical example of how to perform an LVOne test. Using the provided lancet, prick a first finger. Massaging the finger gently can help producing a drop of blood. Then, using the pipette, you collect blood by just touching the drop with the tip of the pipette. To help blood collection, it can be useful to bend the pipette during collection, as this encourages the pipette's capillary action. You may need to massage the patient's finger again to produce more blood. Once the fill line on the pipette is reached, then you can dispense the blood on the test cassette. To do so, it is helpful to touch the paper at the bottom of the cassette's sample port and then dispense the blood by pressing the bulb of the pipette. Gently tapping the pipette's tip at the bottom of the sample port helps to dispense blood. The same procedure needs to be repeated for the second test cassette. Taking the second lancet, a second finger is pricked. Massage the finger again to produce blood, which is collected again by bending the pipette. If needed, massage the finger to produce more blood until the fill line is reached. And again, the blood is dispensed into the sample port of the second test cassette by pressing the pipette's bulb. At this point, you take 1 buffer ampule. You must hold the ampule by its cap and swing it in a downwards movement, like so. This action collects the liquid at the bottom, ensuring dispense of the correct volume. You then open the ampule by tearing the cap and dispense the whole content into the sample port of 1 test cassette. You repeat the same for the second ampule. You swing it, collecting the volume at the bottom, tear the cap, and add the whole content to the second cassette. At this point, it's important to monitor the time, because we need to wait 10 minutes at least before the test results can be read. so having a timer at hand will be useful. We recommend to read the results within 10 to 15 minutes. The LVOne GFAP test produces control and test lines that are blue in colour. A control test line appears closer to the letter C on the cassette, while a test line appears towards the letter T on the cassette. If no test line is visible, like in the example on the left here, then the GFAP test is negative. While if there is any visible test line, like in the example on the right, the GFAP test is positive. On the other hand, the LVOne D-Dimer test produces control and test lines that are red in colour. The D-Dimer test needs to be interpreted by comparing the intensity of the test line against the provided scorecard. Any test line that is as dark or darker than a line 4 on the scorecard is considered a positive D-Dimer test, and vice versa. Any test line that is fainter than a line 4 on the scorecard is considered a negative D-Dimer test. The results of the LVOne test need to be combined with stroke symptom scales. The LVOne test should be performed on patients scoring either 2 or more symptoms on the FAST-CPSS scale, or 3 or more symptoms on the FAST-ED scale, or 3 or more symptoms on the RACE scale. Other clinical scales may also be combined with the LVOne test. A positive LVOne test indicates that the patient may be suffering an LVO stroke. A positive LVOne test is determined by a negative GFAP test, i.e. no visible blue test line, and by a positive D-Dimer, i.e. a D-Dimer score of 4 or above, when compared against the scorecard. This is the only scenario where the LVOne test can be positive. An LVOne negative test can be determined by only 2 result scenarios. One is when both the blue GFAP test and the red D-Dimer tests are negative. In other words, when there is no visible blue line and when the red line has an intensity score of 3 or less. 2. The second scenario is when there is a visible GFAP test line, so a visible blue test line. In this case, it does not matter what the test result of the D-Dimer test is, the LVOne test is automatically negative. There is finally a third possible result, the invalid result, which can happen when there is no control line on either or both the test cassettes, and with or without a test line. This often indicates the test has not run properly and the test should be discarded. For any more information, please contact the Upfront team at info@upfrontdiagnostics.com or visit our website upfrontdiagnostics.com.